Hey, and welcome to Collegiate Parent Mental Health Check-In. I'm Shari, and I, like you, am a parent. I have two kids, 20 and 24, a grad student and an undergrad student. So how am I uniquely qualified to help you with your child's mental health issues? I am not. And that is why I have here with me Rob Danzman. Hi, Rob. How are you?
Hey, Sherry, thanks for having me again.
Good to see you. So, Rob, you are in the college space. You have been a mental health provider for over 20 years. You're a dad, you're an author. I have your book right here, The Insider's Guide to Parenting. And there are a lot of letters after your last name. So, here in this social media world, there is a mental health umbrella, and a lot of people will call themselves life coach or some other creative title. So, tell me a little bit about the letters after your last name and what they mean, and how I, as a parent, can identify if someone on the internet is really qualified and has the certifications to help me and my child.
Yeah, absolutely. So we'll start with the letters, and then we'll go into the other stuff. So there's NCC, which stands for National Certified Counselor, which means that basically I studied a whole lot, took a big test, and I passed this test that said that I'm a smarty pants when it comes to counseling. That's really all it means. The interesting thing about that is it comes from a national board, and there actually aren't very many of us. Not many people take that level of certification, and so there's something a little unique to that. The next is the next set of letters. There's licensed professional counselor, which is LPC, which since the book came out has actually changed in many states, and now it's LCMHC, which stands for licensed clinical mental health counselor.
That
Kind of
is a mouthful.
ridiculous because yeah, these boards are not known for their great branding strategies, but basically we all do we're doing the same thing. The license hasn't changed, just the letters and the words that they stand for.
So just
Um,
like when
but
you have a pediatrician, you look for a board certified pediatrician, right? So it's really that you're
yeah,
certified.
Yeah, exactly. So there's certification and then there's licensing. Certification basically means that you took a test and you passed the test and you got certified, but that's not the same as a licensing. Licensing is associated with a state licensing board. And so all 50 states have licensing boards, and they act as kind of the gatekeepers to behavioral health professionals, medical professionals, healthcare professionals, attorneys, lots of different professions. And so it's really important that when people are looking for any sort of healthcare provider, they look for someone that has gone through board licensing. It's very easy to go onto the internet and find people talking about mental health stuff, and they talk about coaching, they talk about life coaching, they talk about there are lots of other kind of euphemisms, but also like synonymous terminology. The thing to look for is that licensing piece. Are they licensed? There are licensed clinical social workers. There are licensed psychologists. There are licensed professional counselors or licensed clinical mental health counselors. There are lots of different folks who can provide counseling and therapy and mental health services. Actually, there's a chapter in the book where I list out all of them and exactly like what their education background is, because they're
Mhm.
all slightly different, and what they generally specialize in. There are some life coaches who did not go to graduate school and they're not licensed, and they're really good people and they have really good ideas about how to help, but they're not clinicians and there is no oversight for them. And that's another important distinction. It's not that these are all like bad people over there and we're all good people over here. It's really oversight, and did they pass through all of these checks and balances to make sure that they're qualified in terms of what they're doing. With life coaching, there are no there is no oversight. There are no checks and balances. And it's really kind of the Wild West.
So here we are in the middle of summer though. And I think for a lot of parents, especially in the month of July, we kind of feel like July is our free month, right? So we don't want to worry about anything. It's in the middle of summer, it's sunny, we can relax. Our kids have maybe a little less stress over the summer. So can't we just kind of like pretend it's not happening? Like, why do you think it's a good idea to have a summer mental health check-in with your child when things are inherently less stressful?
Right. So yeah, oh yeah, we could definitely just we can hit cruise control and we can just hang out poolside and and yeah, that sounds great. It sounds
It
wonderful.
does.
Uh, one of the problems is, and what we know as clinicians is, even though it's sunny outside and the pool water is perfect, you know, uh, things are still simmering under the surface inside with our kids, with their social networks, with social media. And so just because everything feels good to us on the outside doesn't mean that there isn't something simmering on the inside. And so I like the idea of that check-in for sure, making sure that things are like consistent with like what we see, are kids going to work, volunteering? Are they hanging out? Are they waking up at reasonable times or things like that? But also, how are they doing in terms of the impending or approaching semester? Are they starting to get stressed out about it and they're not talking about it? Are there things happening on social media or some of their dating apps? Or, is everything really okay? And so that check-in, I think, is really just to make sure that we don't need to have some sort of realignment. Because what we don't want to happen is we don't want to be hanging out in July, and then July passes, and then August starts, and then kids get back to college, and then all of a sudden, bam, it's November, and kids are coming home for Thanksgiving break. And then we hear from them that they've been a hot mess since July.
Yeah.
And there really hasn't been a check-in because, like, well, they got onto campus, they got into their new apartment, everything was exciting, but actually things were slowly spiraling down, and so we kind of want to head that off. The
So
work.
how can we as parents though head that off and assess that, Rob? Because a lot of times when you ask your kid how you're doing, they'll say fine, right? So they may
Oh
not
yeah,
have the
yeah,
obvious symptoms. They may be going to work. They may be
right,
having hanging out with their friends, not play dates anymore, whatever they call them now when they're older. They're hanging out with their friends. They're going out. They're not staying in their room all day, but they may not
right.
be okay. So how can we assess that? How do we ask them realistically and profoundly and honestly, besides the superficial, are you okay? How do we ask that to these
Yeah.
teens and adults?
Oh, that's so good, and it drives me nuts when I was a kid and I would get into the car after soccer, rugby practice, or track, whatever. Like, and my dad or mom would say, "How was school?" I would use the F word. I would say, "Fine."
Fine. Yeah.
What is that? It doesn't mean anything. Fine is not fine. Sometimes it is, but it's not nuanced. It's not detailed. So, what I encourage parents to do are ask a set of two questions. The first one is, tell me three things that are going really well for you. Tell me three things that you're looking forward to. So let's call it the positive pile, the positive pile of things, like three things you're looking forward to, three things that are going well for you. Um, and you just drop it in their lap. And in the same conversation, you can ask a follow-up, or maybe later on in the day, or maybe the next day, you ask the other pile, which is, tell me three things that aren't working for you. Tell me three things that are challenging. What are three obstacles that are in your way right now, or you think are coming up in the next few days or the next few weeks? What I just did is something really important. It's no longer it's no longer like yes or no. It's not a binary question. I'm assuming that there are things going well and that they're looking forward to. And I'm also assuming that there are challenges, obstacles, and things that they're worried about. Because if we sit at the point of, is everything okay? We're going to hear a binary answer. And then we're going to kind of get stymied with like, well, how come they're not telling me more? I mean, I'm a loving parent. I pay for everything. Just tell me what's wrong. It doesn't work that way. Instead, let's move ahead and just assume that things are going well and there are things that aren't going well. And the other thing is, like, instead of asking, like, tell me all the things that aren't going well, instead I've limited it to 3. And now what I did is something very interesting from a psychological perspective. I've created a finite list. And as that kid is in front of me and they're thinking about what's not going well, all they need to do is fill in slots 1, 2, and 3. If I asked it more openly, then they're like, oh my gosh, where do I start? Like 25 things that aren't going well. And then they have to prioritize and they get kind of like stuck with it. 3 things they're looking forward to, 3 things that are going well, and 3 things that aren't going well, or 3 challenges that they're about to face. That's how to do it.
So when we're asking them these questions, I mean, I think that a lot of kids will have things to look forward to, like you said, and things that they're having challenges with. So my question is, how do we know whether those challenges are something that requires additional support? If your child says, well, my challenges are, I feel like I'm going to do well junior year because I was really overwhelmed sophomore year and I'm getting nervous. I have to pick my classes. And that sounds like kind of like a normal problem, a normal challenge. How do you distinguish as a parent whether something's just normal or needs additional help and support?
Right. So the way I think about it, I kind of imagine triaging this, or if I was an ER doctor and someone came in and they said, I'm worried about something, and I did an assessment, and there's no bleeding, there's no there's no life-threatening wound, I'm going to say, oh, like you're fine. But the injuries that seem to be life-threatening, that are like eminent risks, where like, oh my gosh, this is time sensitive and we don't have much time to like kind of realign what's going on. That's number 1. We got to take care of that immediately. So for example, with college students, if they're worried about internship for spring of 2022, that's important, but it's not time sensitive. It's not an emergency, and it's anxiety provoking. It's okay for kids to experience anxiety. It's okay for kids to experience that like anxious feeling. My job's not to solve that problem as a parent, right? So I'm going to let them sit with it, and I'm going to revisit that over and over and over again over the coming weeks and months. I'm not going to just forget about it, but I'm also not going to jump in and solve the problem today in July. Now, another problem might be it's pretty clear that they're sleeping longer. They're not meeting with friends as much. They're on like their phone until 3 or 4 in the morning. Is that a safety issue? No, but it could be early stages of like depression. It could be like avoidant behavior. And so checking in a little bit more is important. But again, I'm not going to push, because if I push, that will actually like push them away. I'm not going to pull, because if I pull, it's going to push them away. So instead, what I'm going to do is say like, tell me 3 things that aren't working for you. And then when they say like, oh yeah, I'm not sleeping well and this and that, I do something really important. Well, if that is that much of an issue, I'm here for you. Let's talk about it if you think that you want to like do something about it. And then I walk away. And I give them a little bit of time to actually think about, how do I want to approach my mom or my dad about it? Do I want to approach them about it? And like, what would it look like if that got fixed or if it got mitigated? If I jump in with a solution right away, they don't have that chance to kind of process how to bring it to my attention. So I actually want to give them space. And there are some things that I think it's important to have parameters around, like participating with the family, keeping busy during the day, keeping busy during the week and stuff like that. not working 80 hours a week or something, but making it very clear that within our family, our values are we wake up and we do stuff. And then when we're done doing stuff at the end of the day, we go to sleep. Like just kind of like natural circadian rhythms and participation with other family members and stuff. And I think that really attends to 80% of what parents see and what they're kind of concerned with.
So I think sometimes though it's a fine line. I'm just going to use my own son, for example. So he tends to be anxious about certain things. And as the semester was coming to a close, he would talk to me about all these things he was anxious about. And I thought he was managing them pretty well. And then when he came home that night, he had a full-on panic attack, had to go to the hospital.
Mm,
It was horrible. And I felt like I had failed as a parent because I felt like I was checking in with him. I didn't
right.
ask him those maybe specific pointed questions that you talked about, and I certainly will add them to my repertoire. But I guess my concern and my question for you is for those of us parents who feel like we're doing the right thing, and then our child suffers. We
Right.
tend to I tend to blame myself, like, well, what could I have done that was better or more for him? And how, really, how can we encourage our children to make mental health a priority? Because it's when they go to college, they have to have a physical, they have to have certain things in their
Hmm.
record, but they
Right.
don't have to have a mental health assessment. And so I'm not here to try and change those things in this short amount of time, but how can we encourage our children to make mental health a priority? Just like we say, okay, you have to get your 18-year-old physical. Well, you know what? I did ask my son, would you be willing to talk to someone? And fortunately, he said yes. But how do we help our children know that that's part of overall health is mental health?
Yeah. Oh, so good. I'm going to go through my list real quickly, or at least quickly for me. um, Number one, let's start with fundamentals. Kids learn, and I'm talking about like little kiddos, like 0 to 3, all the way up to adult kiddos. They learn not by the intentional lessons that we provide, like tie a shoe this way. They learn from all the stuff in between the intentional lessons. They learn from us role modeling. They learn from watching us. And as they get older, as they hit preteen and then teen and then college, they learn from watching other people and they move towards the mean. Their behavior moves towards the mean. So, what does that mean? Well, if parents are talking about health, the big health tent, instead of just medical health, and they talk about like going to a therapist to stabilize or to optimize, that's a thing. Like we don't have to go to therapy just to like fix broken things. We can go to a therapist to say like, man, things are going really well and I want to level up. When kids grow up in family systems and they hear how families or parents use different healthcare providers for stabilization and then optimization, well, guess what? Kids are going to use that. Not immediately. It's not like we're going to go to the doctor, come home, and then the next day our little kiddo is going to be like, well, you went to the doctor. I would love to go to the doctor as well. But they will absorb our behaviors. And there's also a shift happening culturally where more and more kids are, it is being normalized that going to a therapist is not this outlier behavior and needs to be secret. And so I think that there is a natural kind of shift culturally where it is being consumed or realigned under healthcare in general. So meaning their social networks are normalizing mental health and behavioral health. So I think that is an important piece of in terms of role modeling. The next one
Absolutely.
is, oh,
Yeah.
and this is a big one for me.
Okay.
I think that we have done a disservice in our culture in terms of over empowering kids. And here's what I mean by that. We if we were to take our kid to, let's say, like the BMW dealership or the Mercedes dealership or the Toyota dealership, and we were to say like, choose a car, that sounds insane for most of us, right? Now,
Yes.
we might have the means to do that. Like we might be able to like pay cash for a car or, finance one. But the idea of like giving that much power to a kid who's 16, 17, 18, 19, 20 seems really irresponsible. And yet we do that with $100,000 purchase or $150,000 purchase, or whatever the price tag is for 4 to 5 years of education. That's crazy. That 18-year-old who might be able to go to war and they can kind of vote, we're giving them the decision for 4 or 5 years of their life, one of the most expensive decisions that they or we are going to make. That's nuts. So I think that kids should have a voice in what happens, but not necessarily a vote. And the same thing is true in terms of healthcare decisions. Healthcare decisions are for adults to make, not kids. Just because someone's 18, 19, or 20, legally, they can make all their healthcare choices. Developmentally and neurologically, they have the brain of a 13-year-old. They don't know how to think about long-term risks. That's why kids vape. If they were older, like putting plastic in your lungs, not optimizing lung function, right? So going to college, you have to have a physical, right? As you said, well, that's the school's mandate. Well, what if parents had a mandate of, yeah, you follow all the school rules, and the parent rules are, if you want to go to blah, blah, blah university, you have to have a mental health check-in. We need to get cleared that you're all good to go, that you are resilient enough, that you like some of that stuff that's going on is all developmentally appropriate. And it's under the big umbrella of healthcare. Totally appropriate. And I think that like we need to be normalizing that in our culture. The last thing is, it's okay for people to not be okay. It really is. It's okay for kids to feel anxious. It's even okay for kids to feel panicky. Not everything that feels panicky is a panic attack. That word has kind of been co-opted, and really broadened. And I don't want people to suffer. But at the same time, I think that we have removed a lot of the friction in kids' lives. Like we have been snowplow parents or helicopter parents or whatever the vehicle is this year that we are. And I think that it comes at a cost. I think that kids are not comfortable being uncomfortable. And so I think that there is some realm or some level that like we need to get more comfortable with them being uncomfortable. And I think that that's a part of this calculus as well.
Yeah, I mean, I agree with you. I think sometimes that we empty nesters want to be like, okay, we're done. We don't need to parent anymore. Like, woohoo. But you're right. An 18-year-old is still a child and needs parental support. And I think that's a really good takeaway from today. As we wrap up, Rob, I just want to, of course, thank you for being here with Collegiate Parent for this mental health check-in. It is the summer and we want to take a break, but it really is important to keep on top with our kids. I suggest all our parents take a look at your book, Insider's Guide to Parenting. It's really, really helpful. I wish I had it earlier in my parenting journey. And I will definitely be asking my kids those pointed questions. I think that that's really great advice. Do you have any last words of wisdom for us, Rob?
Enjoy the summer.
Yeah.
Enjoy everyone's company. And yeah, no, the last thing is, I think that checking in with like our stuff is really important as parents. It's so easy to think that we need to solve all of our kids' problems. And sometimes we need to really take a step back and say like, oh yeah, this is something that they need to figure out themselves. I don't need to swoop in and solve all these problems. If it's becoming a safety issue, if it's not trending in the right direction, then I think we need to step in. But yeah, I think it's important to enjoy the time until August comes and kids head back, and yeah, that's it.
And in the meantime, you definitely should check out collegiateparent.com. We do have a lot of helpful articles, not necessarily to swoop in, but to assist you to help your child as they go through this college journey. So Rob, again, thank you for joining Collegiate Parent for our summer mental health check-in. I wish you all a great summer and good mental health. Thanks, Rob.
Thanks, Sherry.
Bye.